Good medical morning, this is Watson, and today's topic is cellulitis. Cellulitis is a common, potentially serious bacterial skin infection. The affected skin appears swollen and red and is typically painful and warm to the touch. So let's take a deep look at cellulitis. Cellulitis usually affects the skin on the lower legs, but it can occur on the face, arms, and other areas. It occurs when a crack or break in your skin allows bacteria to enter. Left untreated, the infection can spread to your lymph nodes and bloodstream and rapidly become life-threatening. It isn't usually spread from person to person. Possible signs and symptoms of cellulitis, which usually occur on one side of the body, include red area of the skin that tends to expand, swelling, tenderness, pain, warmth, fever, red spots, blisters, and skin dimpling. So what are the causes? Cellulitis occurs when bacteria, most commonly strep or staph, enters through a crack or break in your skin. The risk of incidence of a more serious staph infection called MRSA increases. Although cellulitis can occur anywhere in your body, the most common location is the lower leg. Bacteria are most likely to enter disrupted areas of skin, such as where you've had recent surgery, cuts, puncture wounds, an ulcer, athlete's foot, or dermatitis. Animal bites can also cause cellulitis. Bacteria can enter through areas of dry, flaky skin or swollen skin. Now let's talk about prevention. If your cellulitis recurs, your doctor may recommend preventative antibiotics. To help prevent cellulitis and other infections, take these precautions when you have a skin wound. Wash your wound daily with soap and water. Do this gently as part of your normal bathing. Apply a protective cream or ointment. For most surface wounds, an over-the-counter ointment such as Vaseline or Polysporin provides adequate protection. And cover your wound with a bandage. Change bandages at least daily. Also watch for signs of infection. Redness, pain, and drainage all signal possible infection and the need for medical evaluation.
Cellulitis is a common reason for emergency room visits, and if left untreated, can extend to deeper subcutaneous tissues and cause sepsis. Therefore, it is extremely important that cellulitis be recognized and treated quickly and efficiently once brought to the healthcare professional's attention.
So there you go. Don't forget to subscribe and hit the notification bell so you can see all of our new videos. Do we have any Jersey Shore fans out there? If so, please check out this shout out from Snooki about Thynergy.
Hey everyone, this is Snooki, and I wanted to give a shout out to all the crew at Thynergy. I wanted to just tell you guys to keep losing all the weight. You're doing amazing, and congrats on hitting your goals. Yes, queens. So I lost a lot of weight too, thank Christ. So I know how hard it is to lose the weight and stay in shape. I get it, guys. So keep up the good work. You guys are doing great. Good job. Mwah.
So there you have it. Nicole, aka Snooki, is a big fan of our favorite weight loss supplement, Thynergy. I use it for a boost before a workout and as an appetite suppressant. So order yours today through Amazon with the Amazon link in the description below.